Now we're looking at a very popular vein, okay, in the lower limb, and this is the femoral vein. So here we're not here to look at the anatomy, so to say. We're here to look at the clinical importance. So clinical importance is more of like, why do we study this vein, the femoral vein? Of course, it starts from deep femoral vein, common femoral vein, going down to the main femoral vein. So this vein could be affected by deep venous thrombosis. Okay, so deep venous thrombosis is when you are now having abnormal blood clots inside the vein. So it's blocking the blood flow. It could be life-threatening. So you're having swellings, you're having pain, you're having tenderness, and the color of the skin is becoming different. It's becoming darkish. So central venous access. So I can put a catheter through the femoral vein. Different other veins that could actually put the catheter. This image illustrates them. Okay, but the femoral vein, of course, is very important there. So it's frequently used for all those central venous catheterization, especially in emergency situations. So it's very accessible. Okay, especially in patients that are so ill. So there's higher chance of infection, thrombosis, compared to when you use all those jugular or subclavian veins. So it's also very important in ultrasound, guidance. So surgical relevance is very important in all those vascular surgeries, okay, and trauma management of lower limb. It's involved in all those femoral vein repairs, bypass grafting, thrombectomy, So surgeons must be very cautious of its anatomy. Do you understand? So it's also very important in varicose vein surgeries. Okay. So it's often called the superficial femoral vein, but it's actually a deep one. Okay, it's actually a deep vein. Okay, so that's what we got for the femoral vein and its clinical importance.